In this segment right now, we're going to be talking with Peter Kolodziej, who's from the Tri-Town Health Department.
Correct.
Peter, I want to welcome you for being here this morning.
Thank you, Dennis.
With me. And first, before we get started into what we're going to talk about, which I think we're going to talk in this segment about prevention.
Correct.
How about if you just say, folks, what is the Tri-Town Health Department? You know, what do you do? And a little bit about yourself.
Sure. I'm the director of the Tri-Town Health Department, and we cover the towns of Lee, Lennox, and Stockbridge. We are basically the agents for the boards of health in those three communities, and we cover all of the administrative, inspectional, enforcement activities for the boards of health that are mandated, public health regulations. Many of our programs, basically everything we do is prevention. Everything at the health department is prevention-based, as with this H1N1 is all about prevention. So again, that's the main role that we provide for the boards of health as the regional health department. So we cover all those activities for those boards of health in those towns.
Okay, so when we talk about this H1N1 virus right now,
correct. Yep.
Why is this virus a little different than what we have? You know, every year we have a flu, and so what is different about this? Well,
that's probably something that it started a while ago. Let me read it to you because that's why it's so different. With the H1N1, it was caused by a new virus, and that was first recognized in April of 2009. At that time, it was called the swine flu, if you remember.
This was in Mexico.
In Mexico,
right,
correct.
Okay.
H1N1 flu quickly spread to many parts of the world and is now a pandemic. It's global wide. H1N1 flu is not the same as swine flu, which is a virus that pigs can get. All right, so that's a distinction. It's not the same as seasonal flu. That's what we get typically every year with a seasonal flu. So this is different in that case. And
why would it be different? Is it's more contagious?
Well, H1N1 flu is really, we're seeing that at other times of the year. It's happened, you know, in the summers, and so it's different from that perspective. And it's a different strain. It seems to be more virulent than regular flu.
So when you get it, you're sicker?
Yes.
Okay.
Yes, correct.
Okay, so for those reasons, that's why we're here talking about this today, and discussing, I think, for this segment anyway, what are some of the preventative measures that, you know, I certainly don't think we want to create any panic, you know, and keep in mind that I think even with this new virus, you know, that people shouldn't be panicking, I think, is the main thing.
It's not a panic. You know, the message is no different. It's prevention. And by that we mean, you know, washing your hands when you're sneezing or coughing. You know, cough into your arm, your sleeve. With kids, it's a little more difficult because they tend to be, you know, mixing it up with their friends, and so the parents have to take a greater role in educating their kids, and also at the schools, they're doing a good job about that as well with those prevention methods. Having hand washing demonstrations, enforcing that or encouraging that at the schools, and also making sure that if your child is sick, keep them home. And the same would be true of the parent, you know, be it, you know, workplace, that if you feel you're getting symptoms, or you do have symptoms, stay home. This, you know, the general message is that preventative point, that if it's workplace or school and hygiene practices, if we take that to heart, it's not going to be nearly as bad as it could be. But if people are careless, that's what causes the issues.
Right. Now, when you talk about getting down to some of the specifics, I mean, you know, sneezing into your elbow or sneezing into the crook of your arm is very, very clear what that means. But when you're saying to people, you know, hand washing, I mean, what really are you talking about in terms of hand washing that's good enough to kill whatever virus is on your hands? I mean, I go through this with I have a 6-year-old son at home, and we're always trying to tell him, you know, when he's coming out of the bathroom or he's been playing or whatever, to wash his hands. And he'll go in and run the water for 2 seconds, and you can hear the water run for 2 seconds, and you know he's just run his hands under the water. He hasn't really done a
Correct.
lot.
Yes.
So
that's
what?
right.
So you know, and I'm glad he's young enough still, so he doesn't. If he watches this, he won't really be embarrassed of me telling his stories. But you know, there is a right way and a wrong way. The point is, there's a right way and a wrong way to wash your hands. And so for the folks at home who are wondering, gee, am I doing it right?
If you're just using soap and hot water, then you really want to scrub your hands thoroughly for, say, with that hot water and soap for 30 seconds. And you know, some people use the old method of kind of there's like tune that you sing while you're washing your hands to make sure it's long enough. But however that is, as long as it's thorough, and again, 30 seconds with hot water and soap, that's good enough.
Get a good lather going, kill whatever's on your
Right,
fingers.
but the other thing that many people are using is the alcohol-based products that many of the schools are instituting those and having them different hand wash stations. They're having their nurses talk to the kids, teachers, and so again, that goes a long ways. And just that message of how to properly sneeze or cough into your arm versus just sneezing out openly. If kids understand that, and they are getting the message. See a lot of kids now, they're actually doing that. And so that's going to go a long ways towards not spreading the virus.
Yeah, I've noticed, you know, as a frequent traveler of the Massachusetts Turnpike and user of the service areas on the Turnpike, I've noticed that there are the alcohol-based, you know, in the washrooms there are now the alcohol-based dispensers.
Correct.
That are there for you to use, as well as washing your hands. You can also use those, which I think is a great idea. So the balance in terms of the workplace, I mean, that has got to be where it's tough, because people who may get sick may feel like they can't take time off. And I know, and you probably have had this too happen, where you're working with someone, they're sick, they come into work and they're standing next to you going, geez, I'm so sick, I wish I should have stayed home today, and they didn't, and now they're with you. So that's going to be a big problem.
Well, I would advise that if people don't know what the policy is at the workplace, to talk to your supervisor and get that clarified. But certainly that should be coming down from the top to all the employees, that, you know, get the message out clearly that we don't want you coming back if you have symptoms of flu. And if
we don't want you coming back right away.
Exactly,
Yeah.
exactly. In some cases, you know, that can persist for a while, as far as still being able to transmit that, you know, to other people. After symptoms, fever is gone. Usually it's 24 hours after that, but typically it can be longer. And in some recent studies have shown that you can actually still transmit that for up to 7 days afterwards.
Yeah, I think what I've heard is some of the studies I've read is that what's also concerning about this H1N1 is that even after someone feels better, they're still contagious.
They are. That's correct.
So that's going to be a problem, I think, as well.
But again, you still have, if you emphasize those hygiene practices, you think about those, and the message is clear from the employer to the employees that it's okay not to come to work, then I think that's going to go a long ways. And people have to think about that. If you don't have a good policy from the employer's perspective, you don't have a good policy, you're risking the potential of having a whole lot more of your workforce getting sicker, and, you know, with a large group of folks that, you know, imagine 30% of your workforce that can't be there. You know, how can you function? So prevention from that perspective, it's important, and it's cost effective if you do it that way.
So if I were an employer, it may be in my best interest to say to my employees, if you get this thing, you know, you stay home till you feel better.
Stay home.
You know, which is tough. I mean, that's tough for employers, because they're, you know, depending on your business, you're trying to make, you know, you may need those folks to make money. So that's a tough thing.